My name is Dr. Anthony Colantonio, Medical Director of the Clinic for Specialty Pain Services at Meadville Medical Center. You have been referred for an injection in your lower back, otherwise known as the lumbar spine. The injection is called a selective nerve root block since the medication that is injected goes to a space immediately surrounding a specific pinched nerve in your lumbar spine. If we look at the lumbar spine in side view, we can appreciate that between each vertebral body or bone structure of the spine, there is an opening, and through that opening, there is a nerve leaving from your spinal cord, trying to exit out, make its way across your back and then down your leg. In a cross-sectional view, we can see here the nerve as it leaves from the spinal cord and tries to make its way out of that opening. This is where the pinch can occur. The injection contains a medication very similar to Novocaine, and it is therefore expected that results will be temporary, lasting no longer than 24 hours in most cases. Your referring doctor is trying to isolate the source of your pain, so this procedure should help get that information. If you have a positive response to the injection, which would be indicated by significant relief of your pain, it is highly likely that the targeted nerve root for the injection is the source of your pain. Once that is confirmed, you may be a candidate for future therapeutic injection or possibly surgery. The injection is performed under X-ray to increase the accuracy and safety of the procedure. You will lay in a face-down position for the injection, and it will take between 10 and 15 minutes to complete. For the injection, laying face down, head will be up here, tailbone down here. Under our fluoroscopy unit, I'm able to visualize each bone structure in the lumbar spine, identify that opening of the neural foramen that we talked about earlier. This is where the nerve exits and is pinched. And we'll place a needle into the top portion of that opening and complete the injection. If you have significant anxiety about procedures, you can ask about the option of conscious sedation. The risks of the injection include bleeding, infection, and increased pain during or after the injection. These are very rare. Bleeding is unlikely to occur unless you are routinely taking blood thinners. If necessary, we will instruct you on how to adjust these medications before the injection so we minimize bleeding risk. Infection is also extremely rare. It is very important to note that if you have or you develop any infection or illness between this appointment and your scheduled injection, that you inform our office staff of that situation right away. In that case, your injection will need to be rescheduled. It would not be safe to perform a spinal injection in the setting of an active infection. You may experience pain during or after the injection. This occasionally occurs because the nerve is already pinched and space around it is compromised. The liquid medication we inject may temporarily irritate the nerve as it occupies an already limited space in the area around that nerve. Increases in pain, if they occur, are usually temporary and will resolve within hours to a few days. If we decide to proceed with your injection, it is advised that you have a follow-up appointment with your referring physician around 4 weeks after the injection. This is an appropriate time to evaluate the response to the initial injection. Decisions about additional injections or other treatment options, including possible surgery, will be addressed during that appointment. Onset of relief from this injection is usually within the first several hours of the injection, but it is not expected to last greater than 24 hours.